first I want to just say thank you for coming. Appreciate you being here. So migraines, the migraine class is something that's kind of near and dear to me because it's this phenomena that seems to occur that we almost don't even really understand completely. Yet I'm going to bring up some points that maybe make it a little bit simpler than it may appear to be. And so when we talk about migraines, the one question we want to ask is, why is this happening? And there's different theories and understandings as to the possibilities of why a migraine may occur. So we'll talk about some of those, and I'm going to show you some anatomy and some pictures, and hopefully it'll help you understand a little bit better what happens in a person with a migraine. So there's different types of causes, and we'll, right out of the medical establishment stuff, it is generally believed that in medicine that migraines are of an unknown etiology or unknown cause. We don't really know. So if you look up books and you read about things and look at scientific literature, there's ideas, there's things that are out there, there's tiny little, get broken down into tiny pieces of chemicals, of particles, of things, but we don't really know what it is. What we do look at sometimes, and we'll talk about in a couple minutes, is the difference between causes and triggers, which are not the same thing. Some believe that it is a combination of genetic and environmental factors that cause the headaches, meaning my mom had headaches, my aunt had migraines, things like that, or my dad had them all the time, so I get them too. And unless there's some type of anatomical reason, they have a blood vessel that's distorted in some level or some way in their brain, where there's some malfunction or malformation of the way the joints are in the spine and in the neck, things like that can be a genetically led to cause or make it more likely that it might occur. But it doesn't necessarily mean that one person's going to have migraines because they have the same issue. So it doesn't seem to fall into that category. Environmental causes, well, that falls more into the triggers category, which we'll talk about in a little bit. And what they're saying is that things like, well, I know if I eat chocolate, sometimes it can set off a migraine. If I have too much caffeine, it can set off a migraine. If I have too much alcohol, it can set off a migraine. So there's got to be some other chemical thing in the environment that sets it off. And those, again, we talk more into the triggers than causes category, but like I said, we'll get to that. Recent research is now supporting more and more the chiropractic theory that they're caused by what's called a neurovascular disturbance. So neuro meaning nerve and vascular meaning blood vessel, and that the nerves tell the blood vessels how to function, how to dilate, and how to constrict, and when you want more blood flow or slow the blood flow down to the brain. And those nerves seem to be disturbed on some level, and it doesn't get the right signal and the right message to the blood vessel, and that seems to be what the triggers are. We'll talk about the cause, actually, and there's more research coming out all the time. Triggers are not causes. So if we understand, as I mentioned before, that we have triggers, that means things that are in the environment that may take somebody who's right on the edge of having a migraine and pushes them over the edge. But it's not the cause. And so that would mean that if every time I ate a piece of chocolate, I would have to have a migraine if the chocolate caused a migraine. Does that make sense? So it can't be that, because sometimes people can eat chocolate and they don't have a migraine, and sometimes they eat chocolate and they have a migraine. Or sometimes they might drink a certain red wine that has some sulfites or some chemicals in it, and boom, the next day they have these terrible headaches or trigger what can be called a migraine. And so the triggers are not the same thing. So we have to be clear on that distinction, because what we look at, or what we see in a lot of medicine and a lot of literature, is how to remove triggers but not really fix the underlying cause. And they don't really even look too much into the underlying cause, because we don't really know what the cause is. And once you get that kind of theory in your head, then you don't really waste a lot of time going back and keep looking for the cause. You say, well, we don't really know what the cause is. We keep looking and looking, we can't find it. So let's not waste any time on that. Let's treat the symptoms. Let's look at the triggers and treat it that way, rather than continue to look to what the cause may be and remove that. So the different categories, there are tension headaches, Tension headaches are going to be stress, tension, right? The shoulders stay tight, and that's going to put a little bit of pressure. It's usually going to be in the back of the head. Sometimes it can go to the front, but mostly it's the back of the head and low, and that's from having these tight muscles that are attached to the back of the head constantly pulling and compressing because we're tense. There's what we call a classic headache. There's also classic migraines. Classic headaches are just regular headaches. But the classic migraine, when we get into migraines, is that there's going to be a certain pattern that the person's going to go through as they get into that. And we're going to go into that in a lot more detail in just a little bit. There's what we call chronic, meaning that people are having migraines 1 or 2 a week, going on for months at a time. Nothing seems to be able to change it, no matter how they sleep, no matter what type of environment they put themselves in, no matter what they eat. Have no idea what the causes are, no idea what the triggers are. They're just going on and on and on and on and on. And they go on for years living like that. And then there's complicated, meaning that there's other things that become associated with migraines. Like you may have somebody who ends up with blindness associated with their migraine, or other factors and other things that come into play. And it's not just the headache itself that is a problem. And then there's cluster. So cluster headaches are actually more intense than a migraine. If anybody's ever had a migraine could imagine. They can't believe there's any more pain than that, but cluster headaches are actually more painful. Cluster headaches do seem to follow a genetic pattern in families, and we still don't get those and understand those completely either, but they're a whole different animal. There'll be one single pinpoint spot in the head that you'll feel the pain, and they may only last an hour or two and they're gone, if that long. Sometimes they may only last 20 or 30 minutes and then go away. But incredibly blindingly painful, knock you off your feet kind of a pain. So those are the categories that we kind of put things in for right now. If there's different phases, and this is more of the classic migraine pattern. So I want you to watch some of these things. So there's a prodromal, which is before, and that lasts about 12 to 24 hours. Now the symptoms are important because you have to watch the symptoms to understand when we talk about the anatomy exactly why these things are happening. So irritability, food cravings, and yawning are the most common symptoms for this 12 to 24 hour period before it happens. The key thing that I want you to look at, because they go kind of together, is the yawning, because what's happening is the brain is being deprived of oxygen for some reason. We know this starts to happen. This is the very classic pattern. So irritability, again, food cravings, kind of go with what happens when you start to take the oxygen away from the brain. Sometimes you get cravings for sweet and sugary things because your body feels like your energy's coming down. So your brain thinks energy's down, let me get something sweet. So there's some cravings that get triggered, and irritability just because you're tired and you're fatigued. We're all irritable when we're tired and we're fatigued, right? But the yawning is the key thing, and they go together, but it's usually because there's a lack of oxygen getting to the brain, okay? Aura phase, and it's called aura because aura means things that we see, okay? And we start to develop about 30 minutes to an hour before the headache. We see visual disturbances. One of them, they're very common in migraines. Something's going to happen. People will see floaters, they'll see lines, they'll see like little lightning bolts or flashes, sparkles, all kinds of different patterns in their eyes when this starts to occur. This is again because some of that oxygen is depleting and it's affecting the nerves that go to the eyes, and they start to change, but the pressure starts to build up in the eye too now because things are starting to flip, and how the brain is asking for more oxygen and starts to raise the blood pressure up and starts to force more blood into the brain, starts to take these constricted blood vessels, and it's starting to force them to open against their will, so to speak, because everything's starting to change and they dilate. And now you're flushing blood in and you're starting to build up pressure. And that pressure is then, things can happen to the brain itself. Because of the pressure, you get numbness, tingling, dizziness, and confusion. The key thing that comes up the most common is going to be the visual disturbances in a classic migraine. But any of these other symptoms can occur. The migraine itself typically lasts between 8 and 12 hours. For many people, it's much more than 12 hours. It can go on for a day or 2 days if they're really intense. Throbbing, headache, pain, throbbing. The pressure is so intense in and around the brain They become very sensitive to all of your senses like light, sound, smells. People typically become disabled or can only do very limited activity. They're in so much pain, there's so much pressure on the head. Most of the time they're going to lock themselves in the room, turn off all the lights. They can't have any sounds, they can't have any noises, can't have any bright lights. Everything seems to just aggravate it. Some people will try and sleep it off even. And then of course there's after, which is the post-dromal, meaning afterwards. That lasts about 12 to 24 hours. It's a hangover type feeling, a lot of fatigue, poor concentration, it's hard to concentrate. And so now I'm going to take you through the anatomy of how this happens and you'll understand it even better. So this is what basically happens. We have in our joints what are called nociceptors. And I'm going to go from this slide to the next slide and back a couple of times so you can understand. But these nociceptors are what are in our joints. So if I touch my fingertips, like so, I can do that. I'm watching, right? I'm looking at it. But if I put my hand behind my back, I can perform the same thing, right? I'm not looking at it. But I know where every single fingertip is because of these nociceptors, or what they call proprioceptors in joints. What happens is if those things start to become irritated, they call them nociceptors, and those nociceptors start to fire what we would typically easily explain it as a negative message. Something bad's happening. And when those messages start going to the brain, they're saying something's wrong. These nociceptors typically come from the top part of the neck, and this is when these start to happen. When these start to fire is when we go into that pre-dromal phase. There's something happening, there's something firing. They're starting to cut off the blood flow to the brain, starting to constrict because those nerves are irritated. They start sending irritated messages. And just like if you have tension in your neck because you're irritated, the muscles tighten up, right? We hold tension here. Same thing happens to the blood vessels because they're lined, the arteries are lined with muscle. So when you get these electrical impulses constantly hitting those tissues, they start to constrict. When they start to constrict like that and shrink, less blood is getting to the brain. When you get less blood to the brain, we yawn. We have fatigue. We have food cravings. Maybe we're a little bit more irritable. We don't even know why yet. Maybe we feel tired. I don't know why I'm tired. Second phase. This is what, through the complicated pathway in the brain then changes what's called the sympathetic tone and sends different messages to the blood vessels, taking the vasoconstricted blood vessel and forcing it to dilate and open. So once it starts to open and go against all those other negative messages, forces everything open, now we're flushing blood into the brain faster and harder than it's supposed to be there. And when that happens, all this pressure starts to build up. And as you know with the skull, there's no place to go. So all this pressure builds and builds and builds and builds. That's when we start to get, as we mentioned before, the aura phase. The lack of blood flow to these tissues, again, now everything constricts. We have this inflammatory response. The blood vessels are forced to overdilate, like I said, and it leads to the swelling around the brain, and you're in that actual headache phase now from all that swelling and pressure. And then we talk about the eyes have it. For me, when I'm taking care of a patient who's in the throes of a migraine, if I can get to it early enough, because once that inflammatory reaction starts to go, it takes hours for all that inflammation to come down no matter what we do. But we can still shorten it with an adjustment. But if I get to it early enough, I've had so many patients that get adjusted and they know they start to recognize that pre-dromal phase or even the aura phase, like here it comes, and they get in here, they get adjusted, and that's it, we stop it. Because what we do is we do the adjustment, we calm down all those nerves that are sending all those wrong or irritable messages to those blood vessels, and everything balances out. Once that inflammation's built up, it's hard to reverse all that. And that's that later, that hangover phase. The eyes have it from not only just from the sparkly flashes and the aura and the stuff like that that comes with it, but you can visually see the changes in the pupils of patients. And when they're having those headaches, the eyes tend to be like, oh, like this, right? They're all half closed. And I've done adjustments where the patient sits up from the table and their eyes are wide open. And I know when they can open their eyes like that, they're not as sensitive to the light anymore. And that sensitivity is gone because the nervous system's completely changed and calmed down. Now we're going back into the other pattern and taking it away. Once the swelling has been decreased from the brain, and then we start to return to normal, the migraine subsides, but now you've got to go through some healing and recovery from all that inflammation and swelling, just like any other injury to any other tissue. And that can take hours or even a couple of days to recover from the migraine itself. So, this is a picture. If you can look here, these are the vertebrae of the neck. These are the nerves. And if you look at the nerves, they're attached to all these blood vessels, which are the arteries that feed into the brain. Here's a little bit of a close-up picture of it. This is the blood vessel. These are the nerves attaching to those arteries. And like I said, the misaligned vertebrae in the neck causing that irritation sends those nociceptive fibers first, puts the pressure on the blood vessels, starts to irritate. The second part, the pressure blood vessels reduce blood flow to the brain. What happens? You're yawning, you're tired, here it comes, you start to feel that fatigue, not getting enough blood flow to the brain. The further reduce the blood flow, blood vessels in the head expand, then overexpand because the brain can't be without oxygen. It gets like a panic mode, forces everything to overdilate, and then we have that sudden expansion of it is what surrounds all those blood, opens those blood vessels and causes all the surrounding tissues to become inflamed and irritated. So this, I love this picture, partly because I think it draws like a really good, you can see it, right? Kind of analogy to what's going on inside. But I also love it because this is out of an anatomy book that we all looked at, we all used in school. And it didn't matter if you were a medical doctor or anybody else. It's like we forgot about that. So what happens is that we say, we don't know what causes them, but we learned it. So what happens when we have our treatment options, ways to take care of these things? Well, our choices are remove or minimize the triggers or get to the cause of the problem. The way we remove the triggers is we say, well, we know there's certain foods that are, there's certain preservatives and processed food, MSG, nitrates, there's nuts, cheeses, some fruits, alcohol, caffeine, perfumes, bright flickering lights sometimes is enough to trigger it, fluctuations in estrogen, and anything that really stresses the body, period, can be a trigger for a migraine. So if we remove just the triggers, we haven't removed the cause, so the susceptibility is always there. It could be something else. If we just take the one thing away that's working, triggering me now, it could be something else that triggers it later, because the sensitivity, because the problem with the alignment of the joints has never been corrected. When we fix the correction of the alignment of the joints and all the nerves calm down and don't send those irritated messages, we don't get headaches anymore. Estrogen is a big one because estrogen does have its own vasodilating and constricting properties when it's present in high levels and low levels, and in women, of course, that changes all the time, right? And so those put women at a higher risk for migraines than men. Men still get them, but we have to always watch out for this estrogen pattern when we're dealing with headaches. As women age, you know, young girls, that's one thing. Older girls, it's different. So we have to watch and see those. But it still comes down to that estrogen sensitivity if that problem is being caused by those bones being out of place in the neck to begin with. Because patients that we've taken care of, we've been doing this 30 years now, right? So when we see some patients, they still, okay, well, they were getting 3 migraines a week. Now all of a sudden they only get 1 when it's that time of the month. And so that, maybe we didn't cure them of their migraines in that scenario, but holy cow, who wouldn't take 1 over 20 or 15 in a month? It's hard to even maintain a job for some people because of being out of work for that many days a week because of the migraines that they have. And when you can give them 1 day that maybe they miss a work instead of 10 a month, that's completely different. 1 day that they're maybe in the room because their headache is that bad, away from their family, loved ones, they can't function, instead of 10 or 15, that's a whole different world for that person. We treat the symptoms with medication. So You could run a list. I think we're up to like 287 approved medications or something like that now. So there's nearly 300 approved medications, all with side effects that are not safe. Some of them are actually deadly. We talk to, because what they do is they are vasoconstrictors, because we know the vasodilation, the opening of the blood vessel, is what causes the migraine itself. So we're trying to force medicines that'll bring the blood vessels back down again and constrict them. So even the over-the-counter like Advil migraine means Advil and loaded with caffeine, because we know caffeine is a vasoconstrictor that cuts those blood vessels down. So that's all that is just caffeine mixed with Advil. And so, and if it's the same thing, if it's Tylenol or any of the other brands that are out there, they just put a bunch of caffeine in it to try and get that constriction of the blood vessel with the anti-inflammatory at the same time. And it does help some people shorten the duration or pull them out of that phase, but some people's migraines are too intense, so there are other little tougher medications, shall we say, that if you go to the hospital, and one of the more popular ones is called the Imitrex. Imitrex has a little bit of a bad rap because if, sadly, if you're a woman, middle-aged, and maybe you have a 70 to 80% clogged artery in your heart and don't know that it's there because you don't have any symptoms, and you take Imitrex, you can have a heart attack because it pushes that last 10-20%, because it constricts all of your blood vessels, not just the ones in your head, because medicines don't know where to go. They just affect everything in your body, right? So they start to constrict the blood vessels everywhere. So they can cause damage to kidneys and liver and other organs that need that blood supply all the time, but also in a dangerous way. They do cause heart attacks sometimes. And so it's a rare event, but it still can be a deadly event. If you ask anybody who's having or has had a whole bunch of migraines, they don't care. They will tell you the pain is so bad with the migraine that they will do anything and they will take anything to make the migraine stop. And the people that have had the more intense ones here in the class, they would tell you every time, I know but I don't care. Because anything to try and stop that pain. Think about that level of pain, that you would do anything and even do something as risky as potentially losing your life to take a medicine. They don't care because it hurts that much. And then you got to put your heart into that and understand the intensity of that. So when possible, as we talked about, we have the option to correct the cause, which is to go in and fix the subluxated joints in the neck and take that irritated nerve pressure away, and we can minimize, if not completely alleviate, migraines, period. So the subluxations are the ultimate cause in most cases of these migraines, 70 to 80% of the time. And I would tell you it's probably even more than that in my experience, because 70 to 80% maybe we can completely eradicate the migraines, but I think it's even more often than that, that even more if you add in the ones that we can help dramatically decrease the number of migraines that they have. So for me, I want to tell you about that. One of my things that I want to say is we got to stop thinking sickness is a part of life. So there's a concept that we're just going to get sick. The problem is that we count on medicine a little too much in this country. 75% of all the medications taken across the entire world are taken right here in the United States. That means the other, I don't know how many billion we're up to now. It's hard to keep track. People left in the world, it's 6 or 7 or going on 8, I don't know. And there's 300 and something million people here in the US. Take 75% of the prescriptions in the whole world. The rest of the world finds other ways to deal with diseases before they go into the medicine. And so we're a medicine-hungry society. We want a pill for everything. We want that quick give me a pill, because we want quick, fast relief. But truthfully, we don't get healthy unless we do the work to get better. We have to find out the things that are causing us to be sick and get to the cause and stop thinking, well, we just don't know. Because maybe we learned about it back in school and we just forgot how the nervous system controls everything in the body, and that a healthy functioning nervous system gives us our best chances of being healthy.
Thank you for watching our video. If you like what you saw, be sure to subscribe to our channel.
Yeah, and like us on Facebook. There's always a lot of information also on our website at rosemontchiropractic.com.